Parenting sites are flush with questions from parents about their kids' health. Well, we're about to give you some answers, and joins today is pediatrician and the author of Baby and Toddler Basics, Expert Answers to Parents' Top 150 Questions, Dr. Tanya Altman. Doc, welcome.
Thank you.
So obviously you're a pediatrician, which is why it makes sense to write this book, but tell us about the book.
Really?
Tell us what inspired you.
So I wrote this book with the American Academy of Pediatrics because parents have so many questions. And although everyone can Google, we know there's a lot of fake news out there, right? Especially when it comes to health and wellness. So I wanted to gather accurate answers to the top 150 questions in a really simple form that parents could carry in their baby bag or keep on their nightstand, because let's face it, a lot of questions arise at 2 a.m., right? And you gotta know right then, is that green snot dangerous? Should I wake up my pediatrician or can I go back to sleep?
So
Cars come with a manual, kids don't.
I know, so I wrote one.
All right, so you up for some Q&As?
Hit me.
All right, so the first question from Facebook is, my baby is really congested. What can I do to help her breathe more comfortably?
You know, babies have very small nasal passages, so a tiny piece of mucus can make a really loud noise. So if it's not interfering with feeding or breathing, I usually say don't let the noise bother you. But if you want to relieve the congestion, a little bit of nasal saline, or I like to use breast milk if mom's breastfeeding in each nostril, you can pick your favorite snot sucking device and gently suction it out. And that's usually all you need.
A little bulb syringe, if you like.
I love bulb syringes, you know, from the hospital, but there's all these great new devices now where you can suck with your mouth, or they're battery operated. Don't worry, there's a valve. It doesn't go in your mouth, maybe. But it is important to know true signs of trouble breathing. So if your child's chest is going in and out, if they're not feeding well, if they have a fever or look sick, then call your own pediatrician.
All right, let's take another question. This is, my child has these small bumps on his body. Should I be worried, and what can I do?
So I'm sure you see lots of skin bumps as well as a dermatologist, and kids get them all the time. And I usually tell parents, if it's not bothering your child, it doesn't bother me. But this one really bothers parents. It's called molluscum contagiosum, and it's a really long, scary name. It is very contagious, but it's totally not dangerous. It rarely itches, it rarely hurts. But as I said, parents just don't like to see bumps on their child. If you leave it alone, it will usually go away on its own, but it can take 6 to 12 months. So there are some things we can do to get rid of them. I know in my office, I'll use a little of the beetle juice sometimes, or freeze them. Sometimes we'll do over-the-counter treatments and a little duct tape. And I know when I refer to dermatologists, they often just remove them with a curette.
Yeah, so as you said, these are little viral bumps, so very contagious, spread by skin-to-skin contact, but definitely keep them covered, because the virus can survive even on toys and other objects. So if they're around other children, you just want to be careful. They can also spread on the child itself, especially in kids with eczema, where their skin barrier is disrupted. They can become very widespread. And the reason they go away on their own is because, as with many viruses, you develop an immunity to it as your immune system develops. So kids sometimes outgrow them, but the reason to see your pediatrician or dermatologist is if they're just spreading so rapidly, or they're becoming contagious to the other children in your family.
I mean, rashes in kids are so hard to navigate. They get so many different rashes many times for no apparent reason. It's difficult to know when do you pay attention. I mean, you want to look at your child. If they look sick, then that's...
Yes, if they have a fever, if it's really painful, if it's uncomfortable to them, you know, then definitely show your pediatrician or dermatologist. But a lot of these things will go away on their own.
I want to hit one more question.
Yeah.
I found a red streak in my newborn baby girl's diaper. Is this blood, and should I be concerned?
This really freaks parents out. I mean, just imagine going to change your little one and you see something that may look like blood. So in little girls, it sometimes is. They can get what's called like a mini period. It's a little withdrawal bleeding, because when you're pregnant, they're exposed to your high hormone levels and then they come out, but you shouldn't see it after a week of age. The other common thing that looks like blood but isn't is called urate crystals, and it's a little bit of a brick substance like women's bronzer in the diaper, and it's due to the fact that they haven't been feeding enough and really cleaned out their bladder yet. So the more they eat and the more they pee, then it'll go away. And again, in the first week of life, it's normal, but after that, talk to your doctor, because it could be a sign that maybe your baby's a little dehydrated and they're not feeding quite well enough.
All right, so I have 147 more questions. What should I do?
I'm so excited.
Oh, well, if you all just had that thought in the audience, you're in luck. You're all going home with a copy of Tanya's new book, Baby and Toddler Basics. Dr. Altman, thank you.